First of all, I apologise that I cannot be there with you today, but I was keen to provide this message for you all. I would like to thank Healthcare Improvement Scotland for their work in organising this event today. I do not underestimate the amount of work that goes into gathering people together, both virtually and in the room, supporting us all to talk and, importantly, to listen to each other. It is wonderful that so many have been so keen to take part today and to know that so many people from across the health and social care sector are gathered to discuss how we can continue to deliver safe care and to become even better at doing so. As you will know, better than anyone, the delivery of safe care for everyone all the time needs to be a focus in every part of our system, in every corner of our country. Most importantly, I would like to take this opportunity to thank all of you attending for the work you have done and continue to do to make health and care in Scotland safer. The ongoing success of the Scottish Patient Safety Programme and the associated strands of work is a testament to your hard work and the work of your colleagues across the country to improve care for some of those people who are most at risk. Never has that been more important or more apparent than now. You and the other committed professionals you work with every day have kept a focus on safe care during some of the most difficult times of our lives. You have made a life-saving difference, so a huge thank you to you all. In my role as Minister for Public Health and Women's Health, I recognise the paramount importance of safe care. When people need to access any part of the health and care system in Scotland, they must have confidence that they will receive treatment that is effective, person-centred and safe. The Scottish Patient Safety Programme has been vital to achieving this ever since it was first started. When it was launched in 2008, it was the first programme of its kind anywhere in the world. Over the last 15 years, it has delivered improvements in areas ranging from cardiac arrest to stillbirth to sepsis, to name but a few. When I think what that improvement means to patients and their loved ones in deaths avoided and lives saved by the hard work of you and your colleagues, on their behalf, I would like to thank you. More recently, 7 acute hospitals across Scotland are demonstrating improvement in at least one outcome measure related to either recognition and response to deteriorating patients or reducing inpatient falls. This is just one example of many, and it is down to the hard work and dedication of you and your colleagues. The Scottish Patient Safety Programme continues to be vital, probably more now than it ever has been before. Your focus on patient safety has been crucial over the last few years in providing the environment and the conditions that enabled NHS Scotland to be flexible and adapt quickly to the greatest challenge our healthcare system has ever faced. The focus we all place on patient safety did not stop during the pandemic. Now, as we emerge from that intense couple of years and faced a host of different challenges, the continued revitalisation of Scottish Patient Safety Programme and our concentration on patient safety more broadly is critical. The future of the Scottish Patient Safety Programme is incredibly exciting. No doubt it will be the subject of many valuable and interesting conversations throughout today's event. But we know there is still more to do to continue to improve safety. As a key component of the Scottish Patient Safety Programme, Essentials of Safe Care focuses on person-centred systems and behaviours with the aim of enabling the delivery of safe care for every person within every system, every time. It highlights the need for safe communication within and between teams, safe and consistent clinical and care processes, and leadership to promote a culture of safety for all. By bringing together these key facets, the basic foundations are created to support the further work on safety. One of the aims of today's event is to explore the organisational and system-wide conditions that enable the safe delivery of care amidst increasing system pressures. In order for our healthcare system to be as safe as possible, we need to be able to identify where the concerns of individual patients may point to a wider pattern. For too long, patients have sometimes found it hard to be heard when they have concerns about the safety of their care. And the Independent Medicines and Medical Devices Safety Review from Baroness Cumberledge clearly told us that there have been times when, while individual concerns have been listened to, they have been considered as one-off complaints rather than being indicative of a wider safety issue. That is why it is so welcome that the focus of today's event is on the system-wide conditions for safe care, and why I'm delighted to say that we are approaching the final part of the parliamentary process in establishing a Patient Safety Commissioner for Scotland. This role will promote and improve safety by developing a system-wide view of healthcare and using that insight to identify safety issues. The Commissioner will have an important role in bringing organisations together to take action on patients' concerns. They will work with existing organisations and healthcare professionals to enhance coordination across the healthcare landscape with the aim of promoting improvement. They will complement the vital work being led through the Scottish Patient Safety Programme and being done by you and your teams, rather than duplicating patient safety work and systems that are already there. And most importantly, considering the theme for World Patient Safety Day this year, the Commissioner will listen to patients' experience. They will amplify the patient voice and advocate for patients to be listened to, driving positive change and making healthcare safer for us all. Creating a Patient Safety Commissioner for Scotland is a step that has been very widely welcomed, and I am grateful for the support I have received from across the patient safety landscape for the establishment of the Commissioner. I have every confidence that this is the right thing to do and will enhance the strong foundation we already have in Scotland on patient safety. I know that you will be keen to get on with the day's agenda, so please allow me to say one last thing before I wrap up. I am so sorry that I'm not able to join you in person today, but I continue to be encouraged and excited about what the future of safe care in Scotland holds. As you continue to share and integrate your learning during this event, know that you are all working together to deliver safe care for everyone, all of the time. I'm sorry that I will miss Penny Pereira and Dr. John Bolton presenting on the Creating the Conditions for Safe Care. I hope you enjoy the event and the many interesting discussions that you will have. Thank you.